I'm Dr. Kiran Seth. I'm a physician rheumatologist from Metro Group of Hospitals. Home healthcare is a newer concept which has been introduced in our country. Actually, the concept has come from the Harvard School of Medicine and the Public Health, and it is a way of providing safe care to the patients in the home environment so that they can recover fast, as well as it cuts down the medical cost to about 1/3. So the idea is to give the safe care from a hospital at the home, where the patient can be monitored by a 24/7 a nurse or a doctor if required, and the patient selection is actually made in the casualty itself, because first time the patient visits the hospital, and if it fits into the validation criteria, then the patient is shifted to home if he can be taken care at home. So various equipments like the BP machine, a BP instrument is required at the bedside, and maybe the patient needs a respirometer and a ventilator or a BiPAP machine. Sometimes a dialysis machine is also the patient can be dialyzed at home, and there are various other equipments which are needed sometimes, which has to be arranged bedside. We select the patient who are very those who are not very complicated, and their at home the care can be given selectively, and these equipments they can be handled by the trained nurse or the staff, which is given to the patient at home, and the doctor can also visit and this thing. So it's a very safe system, and if the patient is heading for any complication, then the patient can be duly shifted to the hospital on the evaluation of the doctor who is seeing this. It's a very safe system. By and large, the staff is very much trained to look after all this, but continuously they are in contact with the medical person, because if sometimes these machines they don't work properly or there is any default, then they can contact the doctor or this thing. By and large, the medical practitioner is not needed at the site, because the staff who is well trained can take care of these equipments and can use the equipments very nicely. It's really very successful. The concept is very much picking up in India, and because the bigger hospitals, when there is no bed availability and they cannot give the care, so now the staff is the trained staff is in access. This kind of system really works.